Welcome to Lost Girl Therapy. So I had a mini POTS flare yesterday, and it occurred to me that if somebody who did not have POTS experience what I just went through, they would go to the ER. And I'm not saying that to toot my own horn. I'm saying that because it blows my mind that I am somebody who's experiencing all of these things, and I'm like, yeah, no, don't worry about it. It's totally cool if my vision starts going in and out, my body starts shaking, I actually can't feel my limbs, my heart is racing, I actually think I'm going to throw up. Wait, I'm not going to throw up. My stomach is now in knots, the room is spinning, I'm having difficulty breathing. Don't worry about it. I just need to sleep. If somebody lined up the amount of symptoms that my body goes through with POTS when I'm in an episode, or when I'm on the verge, a pre-syncoscope, and they were like, hey, choice between going to the doctor or staying home, and they if that option was presented and I had not lived everything that I've lived, I would immediately be like, no, you should go to the ER. Right? Your heart rate is through the roof, you're shaky, you're nauseous, you're kind of going in and out of consciousness. Def time to go to the ER. And yet here I am 3 years into this journey, and I'm totally fine, don't worry about it. Throw me on a couch, give me a blanket, let me sleep for 40 minutes, make sure that I'm still breathing at a certain point, we're good. The medical community needs to catch up with the number of women that are experiencing dysautonomia and POTS, because we cannot keep living like this. I cannot keep having these episodes of okay, we're down for the count, now we're back. Look at me, I'm fine right now. We're totally good. I feel 100%. Yesterday, I had to lay down 7 times just to get through the day. The medical community needs to stop dismissing women as being overly anxious or being hysterical, and instead work with the women like myself who are having these experiences to study what we are going through in an effort to heal it. Because we can't keep doing this. I can't keep living the next 10, 15, 20 years of my life needing to take a reset day once a week. That's dramatic. It's probably once every 3 months now, but when it was really bad, it was once a week. I can't keep doing that. I can't keep needing to power down and then power back up like the Energizer Bunny just because my body decides that it's going through something. Women's health is critical, and the lack of knowledge, information, and support from the medical community is glaringly obvious as I'm moving into my 4th year of having this, because I hear countless stories all the time, and I actually hear it from moms who are dealing with kids and their daughters who are in their late 20s, early 30s, and the moms are saying my daughter was fine and now she's not. My daughter was adventurous and she went everywhere, and then all of a sudden she can't walk down the block. My daughter is overcome by all of this anxiety and she just can't, and it's so unlike her. And then I sit on the other side of that conversation, having lived it, and saying, it's not in her head. It's not in her head, and she is not crazy, and this is not just anxiety. This is a physical problem that is going on. But because the medical community has not followed up with that, because there is still this overabundant narrative that somehow type A, people-pleasing overachievers with a predisposition to an autoimmune disease are suddenly now all getting dysautonomia, whoopsie, that ain't gonna work. And I can feel the anger bubbling up in me because it took me so long to heal, to get to the point where I was not having flares once a week. I was having it once every 3 months, and I'm very grateful for that. But I'm so angry at the number of years that I had to go through, and the number of times that I had to yell and scream and throw a tantrum in doctors' offices to get taken seriously. And it breaks my heart when I hear stories from these people who say, my daughter's going through the same thing. They're just giving her an anti-anxiety med and nobody can figure out what's going on. If you're in the medical community and you have patients who are experiencing this, please stop dismissing them. We are not crazy. We are not having nervous breakdowns. We are not hysterical. We are upset, overwhelmed, chronically ill individuals who have had their lives taken away from them for unknown reasons that nobody is taking seriously. And if you were in that position, you'd be as angry as we are.